What exactly is GBS?
Nothing to be much worried. I'll explain it as easily as possible.
Why this comes in an ascending format?
Yeah, there's a special reason.
Then what immediate steps are taken at the hospital?
These are like red flags.
Washing the blood. Does it make the patient feel better at the very immediate instance, or just it freezes that condition?
See, there are basically two important options.
The family member's role is getting these patients get back to a normal life.
It's very important.
Hello everyone, welcome to 2050 Healthcare. Today we have with us Dr. Mitalee Kar, who is a senior neurologist working with Care Group of Hospitals. Namaste ma'am.
Namaste. Namaste.
Today we will be discussing about GBS. Kindly help us know what exactly is GBS.
Guillain-Barré syndrome, shortly known as GBS. Guillain-Barré syndrome is a type of acute demyelinating polyneuropathy. Our scientific way of telling that. Nothing to be much worried. I'll explain it as easily as possible. GBS is the name which was coined after the scientists who described this condition in multiple patients. Guillain-Barré is the name of the scientists who were working on these kind of disease conditions, and they were the people who also described it exhaustively, and based on their whole research, this condition came into spotlight and people got to know about this condition. So that is the name why it is called GBS. It's basically a disease where the nerves of our body get demyelinated. By demyelination, I mean is that there is a myelin sheath on the nerve cells. So when this nerve cell myelin sheath gets lost due to some disease process, we call it demyelination. And when this happens, the signal which crosses through the nerves gets affected very badly. And as you understand, if there is no signal transmission between two nerves, then the function associated with that nerve gets lost. So that is how this disease is actually described.
Ma'am, if somebody gets this disease, and what is the first thing they feel?
Yeah, GBS, when it strikes, then you can start getting a tingling or numbness in the toes, and then it may start ascending upwards. The classic presentation is that it ascends upwards from the toes to the foot to the leg, then to the thighs, and then it goes up to hands and your trunk, neck muscles, and even respiration and even face can get involved in this ascending paralysis.
Ma'am, is there any special reason why this comes in an ascending format?
Yeah, there is a special reason. Why? Because the longest nerves get affected first. The longest nerves has a longer myelin sheath, if we understand it that way. So the longest nerves of the legs get affected first. Its demyelination starts, and that's how this is usually in the ascending fashion, which is also a very important differentiating factor from other illnesses which can be present in a different form.
Ma'am, we often hear GBS follows a cold or stomach bug.
Yeah, usually GBS comes after a small transient infection. The common cause is actually GBS happens in a post-infectious state. Why? Because the small infection trigger which happens after a common cold, or it can happen after a bad stomach like acute gastroenteritis, because these bacteria or some viruses can immediately act as a trigger to the immune system, and the immune system gets haywire and it starts working against our own body. Auto antibodies are generated and the myelin sheath gets destroyed by that. So usually there is a preceding viral infection, but it can also happen post vaccination. It can also happen in other conditions where this infection may not be there, preceding infection may be absent.
Ma'am, how fast can this disease progress?
Yeah, in unfortunate cases, it can be really, really fast. Like they can deteriorate over in 24 to 48 hours as well. So, but usually the nadir is 4 weeks. Usually it ascends, and within 4 weeks you get maximum 2 to 4 weeks you can get maximum impact. But in some cases it can be really rapid progressive, so much so that they can have frank breathing difficulty and they are not able to breathe totally, and those patients are actually have very bad time and like can land up into ventilators also.
Ma'am, as we understood, like here a simple virus can also debar the entire immune system, right? So like what exactly can be a very major sign or symptom which will help the person or their family members to understand that this is an emergency time and they need to rush to a hospital?
Okay, yeah, this is actually very good question. Why? Because we often think that this is post flu, post common gastric upset,
Yeah.
so which has causing this lethargy, fatigue, and let us take some rest and then it may go away. And in 90% cases of it can be true also. Just after post viral, you feel fatigue, you feel malaise, you feel tired, lethargic, and you don't want to work, and you have body pains. This is post myalgic syndrome, which can actually happen. It's very common, but we must stay alert. If there is a symptom which is suggesting that it is ascending, like your toes were having tingling, numbness or weakness, and then it is ascending towards your legs and it is going upwards involving your thighs, legs, you are not able to sit up in the bed, you are having difficulty in turning in the bed, you are having shortness of breath, you are having breathing difficulty, you are having swallowing difficulty, face is turned, or any of these kind of weakness, you having grip loss or something like this, then you must immediately visit a neurologist and get some basic tests done to at least rule out that whether you have caught this disease or not, because it's not easy to just come to a conclusion just by staying at home.
Ma'am, whenever this kind of a patient approaches a neurologist, what are the first steps which are undertaken by a neurologist, or what are the tests which are undertaken?
We usually, first is clinical history, because they have this classic presentation, and then we suspect that there is a possibility that he may be suffering GBS. Then we get a electrodiagnostic test in which there is a nerve conduction is done, and it is done at the labs where nerve conductions can be actually measured. So it needs a proper tertiary care hospital where these facilities are available. Along with that, in some cases, if we are not able to conclusively decide, in some cases MRI may be required, where there is a close differential diagnosis of some other disease. For ruling out the other diseases, some times MRI may be required, but mostly clinical history taking and the electrodiagnostic gives us the answer. And usually before starting any kind of treatment for these patients, we suggest getting a CSF, which is also a very important clue for further medication which we plan for the patient.
Ma'am, if a patient reaches the hospital stating issues while breathing or swallowing, then what immediate steps are taken at the hospital?
These are like red flags. If you are having a patient who is having breathing difficulty, who is having swallowing difficulty, who is having fumbled voice, mumbled words, then these are the times where you should not wait and watch and have just looking at him, because these patients can deteriorate fast. These are the ones who need priority attention. These are the ones who need priority tests to be done, and immediately medications has to be started, because as I said, GBS in some patients, in some unfortunate cases, can be very fast progressive. So we have to be very on high alert for these patients, and we have to catch them early and start the treatment. So if the patient is having ascending kind of paralysis, as I told, number one. Number two, swallowing difficulties there, breathing difficulties there, face is getting turned, or these kind of features are coming, please immediately visit an emergency or visit the neurophysician as early as possible.
Ma'am, we would actually like to know something about the process, like whenever the patient is getting admitted, how the treatment process actually helps to avoid further danger to the patient.
See, early diagnosis is key for all neurological illnesses, basically, be it stroke, be it seizures, be it GBS. So for all these conditions, early diagnosis is important, that you are on the right track. If the diagnosis is confirmed, then starting the correct drug for GBS. GBS is basically, you have to understand that the antigen, we have a chore police, no? So the outside antigen is the chore, and our bodies, the police, should catch the hold of this thief. But what happens is, when our own body's policing mechanism turns against you, that can cause a havoc in the immune system, and it can cause havoc on your body. So you have to get that set quite fast. So you have to understand your own police system is not working as it should. So that is the time you cannot waste just guessing around.
Ma'am, we have heard like few terms like washing the blood and like, can you please help us with understanding that?
Yeah, this is, I think, the local way of telling about plasma pheresis. So basically, I was telling that the own police system is actually becoming the enemy of the body, isn't it? The auto antibodies are formed against the nerve proteins. So they are eating away their own nerve proteins, which is like a bad thing. So now what happens is, we have to get these bad things flushed out of our blood system. So this is basically a kind of filter which is used, that is called plasma pheresis, in which we filter the blood through a machine. It's a very similar machine to the dialysis for the kidney patients which is used, and then this blood is completely filtered so that these bad things are taken out from the blood. It's basically that's what in easier way they called what did you say? Blood washing. Yeah. Blood washing.
Yeah.
So, yeah.
Ma'am, once these kind of treatments are in place, so does it make the patient feel better at the very immediate instance, or just it freezes that condition?
See, there are basically two important options for GBS patients. That is, one is IVIG and another one is plasma pheresis. So whatever treatment is given, we have to wait with patience for the recovery. This is basically to get the damage control. Both the treatments are basically a damage control mechanism. They will just try to stop the havoc which is being created, and they will try to halt the progression of the disease. Immediately, the damage of the nerves which has already occurred will take time to get repaired and healed. That is the basic understanding we have to explain to the patient. Often they get disheartened and disappointed, and they get like depressed also. Why I started with such a costly injection, and why I am not able to still move my hands and legs, and whatever, 5 days are over. These drugs do not work immediately. They need a timeline of at least 2 to 4 weeks to show its optimum effect, and also the recovery can last up to 18 months. After these drugs, these are acute therapies which are given to hold the further damage. So immediately damage control has been done with these drugs or the plasma pheresis, whatever is chosen based on the neurophysician's direction. And then after that, immediately neuro rehab comes into play, which means that they have to start the physiotherapy, they have to have a positive mindset, they have to be like on watch for further deterioration of symptoms is happening or not, any other complication is coming on their way or not. And after that only we can expect a recovery over a period of 4, 6 or 8 weeks. And in some patients it can be delayed up to 18 months also. So that is how it is all about.
Ma'am, once this damage stops, like eventually how do the nerves repair themselves?
Nerves repair themselves only. That's how it happens, because once you start your physiotherapy, the nerve connections again start forming. They again start communicating with one nerve cell, communicates with the other nerve cell, and gradually the repair of the myelin sheath, and new myelin is now created, and gradually the nerve sheath again gets repaired. So it takes time to build that nerve which was damaged again. So that is why having patience and doing regular physiotherapy, building your muscles, preventing contractures, preventing any bed sores in case the patient is bedridden, is very important. So that's why these are time taking process. There is no direct drug to immediately repair your myelin sheath immediately. So it takes time and a lot of patience and physiotherapy to completely get yourself back to walking.
Ma'am, as you had mentioned earlier, like in some cases it takes around a month or 2 months, in some cases it takes around 18 months. But if we are not talking much about the timelines, like can these patients ever lead a normal life once recovered?
Yeah, most of the patients lead a normal life. There are very few patients who actually land up in a very bad situation or get a wheelchair bound, or like mortality happens in a very few patients. So it's not a bad news to be diagnosed with GBS. It is how we address it that is going to decide the prognosis, whether it will be going to be bad or good. So you should not be disheartened with the diagnosis. The earlier the diagnosis, the better it is, and the earlier the treatment is initiated, the better it gets, and the best outcomes only come with a good teamwork of a neurophysician, of a physiotherapist, and obviously of a very good family member.
Ma'am, if we consider the rehabilitative part, with proper physio rehabilitation, these patients, they can we assume that the onset of this disorder in future course can somehow be like we can just eradicate the very feeling of getting that disease back again?
GBS can reoccur. So it's a true fact, but it's not that very common that abhi 6 months back you had GBS, then again you will get a GBS. It's not that common. So you don't have to live in a fear that again this will happen. Usually it's very rare to get repeated GBS. But if you get converted from acute AIDP to CIDP due to lack of treatment or lack of proper guidance, then it can become a problem where acute thing gets converted into a chronic thing. That then there can be a problem, but repeatedly same person getting a GBS is not that common.
Ma'am, do these patients live on a lifelong medication?
No, not at all. Maybe lifelong active lifestyle, having a lifelong good physio plan can be a good helpful for them, but definitely they should be on watch, because once they have suffered very badly, they should be on watch for a good health in general. Having a good exercise, good sleep, and good not having a diabetes or hypertension is definitely important.
As you have been mentioning, like the physio part, a doctor's care and the family members all have to work in unison.
Yes,
right?
yes.
So I would request you to just give us a message, like how important the family members' role is in getting these patients get back to a normal life.
It's very important to get them back on toes, get them back on wheels. It's very important to have a very supportive family, because when the patient is not able to move or is paralyzed, it's very hard for the loved ones, the near and dear ones, to see your own person in that state. It is quite understandable. So the whole thing is that please do not become disappointed, become depressed along with the patient. Patient is suffering. You have to stay positive. You have to build up the strength, get the inner strength, and have proper questions asked to your doctors, like what can you do further to get him better. Along with that, having a positive mindset in and around the patient is very important. If you stay depressed, you will make the patient also depressed, and they will lose their positive outlook. Lot of patients, after even getting to ventilator, have bounced back to complete normal life. There are a lot of examples of that. So you need not lose hope in that. Believe in your own self and believe in your physiotherapy team, because that is the most scientific way of getting him back to the tracks. So that is very important, and taking correct advice at the correct time, and a correct neurophysician, physiotherapy team, and a correct family member who is all in unison have to work together to get a positive outcome for the patient.
Ma'am, thank you so much for sharing all these important facts about GBS today.
Thank you.
Thank you so much.